So if you've had vertigo and or problems with your vagus nerve, breathing is a really important aspect of managing and controlling it. Today I want to go over a really unique breathing technique that has helped a lot of our patients. So if you don't know me, I'm Dr. Gregg Gerstin with Align Wellness Center, and I've been helping people to remove the blockages in their health for the last 20 years to lead amazing, fantastic lives without drugs and surgery. I mean, who wouldn't want that? If you or someone you know likes it, go ahead and hit the subscribe button. We're constantly sharing information on how to achieve that. For this one, we're going to go over a method called compartmentalized breathing. And this is something that really connects with my life work. And my life work is really focusing on the spine and the nervous system and how it works. When we're doing compartmentalized breathing, what we're really going to think about is what happens within some of the body regions as we're taking our breaths. So what I want to do is just take you through the steps on what you're going to be looking at as it relates to the skull in your head, the neck, the torso, your lower back, and then your sacrum. Because all of these pieces wind up moving as you're breathing. They actually help the breathing process to happen. So if they're not moving properly, then you may not be able to get full breath, and can be why you've been experiencing stress and problems related to vertigo and or your vagus nerve. So when we wind up taking a breath in, you may notice that my head extends and my cervical spine bends back. You may notice that my chest deepens and opens up. My lower back curves more and my bottom side goes back. That's what we really want to see. That winds up allowing for the lung cage to have the biggest perspective that it can, so it can fill up as much as it can. Then what we want to be sure that we do is when we breathe out, pretty much the opposite. So our head is going to compress down, our neck is going to flex forward, our thorax is going to close up, our lower back is going to condense, and our pelvis is going to flatten out. These steps, if you wind up doing them while you're taking your deep breaths in and out, doing your box breathing, will really help and take those things to the next level. If you're wondering what or how to do your box breathing, go ahead and check out this video on it. I've done it, it's helped a ton of people. I want to make sure that you get connected with it. If you've got more questions about the best breathing process, feel free to write them down below. Also, if you know someone who's been challenged or having problems with taking those deep breaths, pass this video along to them. It may help them with coming up with a sequence of what to think about as they're taking their breaths to take their health to the next level. If you've got more questions, go ahead, write them down in the comments. I respond to all the comments as quickly as I can. Once again, I'm Dr. Gregg Gerstin, and I want to thank you for letting me be a part of your health.